Go live. Okay, so thank you to everyone for joining us today. Sorry for the delay, but we are about to get started. Again, welcome and thank you for joining us today. I'm excited to have my colleague Doug here with me, and I am also waiting to have some other colleagues join me. Today, we're going to have a conversation about chronic care management and remote patient monitoring. There's been a lot of talk lately about these programs as more people begin to learn about them. So we wanted to share some of our knowledge and really have us just chat about those services and how they can benefit patients, physicians, as well as nurses as well. So I am Natasha. I'm a registered nurse with over 20 years of experience in long-term care, home care, and hospice. And I now work as an independent nurse consultant in chronic care management and remote patient monitoring implementation. I help teach providers how to implement these programs within their practice to help improve patient health outcomes, reduce their patient workload, and increase their practice revenue. And now I'll have Doug introduce himself and tell us a bit about what he does in remote patient monitoring and his experience and background.
Thank you, Natasha. My name is Doug Sullivan. I'm also a registered nurse and a certified case manager with CCMC and with the CMSA organization. We're about 100,000 nurses that have been doing case management for the health plans over the years and for workers' comps and different things like that. That's where I really got my start with the administrative side of nursing. Learned a lot about nursing as far as how it is with public health, and then about 9 years ago formed my own company, case management company, with inside a practice with a practice partnership, and started doing RPM um, to work with the tech companies to get those processes in place so we can manage and monitor people, not only with CCM, but RPM and several of the other programs that are available right now. And we've been helping at a granular level, helping the practices, but also at a more scaled level, helping the tech companies to put the pieces together in this area. And we're really excited to work with people like Natasha that understand that more and more nurses need to understand how to utilize case management and utilize their night license at the top of their license and be able to be involved with these programs as independent contractors, because we feel that that is definitely where we want to fill the gap. The salespeople for the tech companies are just don't have the capacity or knowledge and background to do this. We need nurses that understand how to write those notes, how to call those patients, and how to execute on those treatment plans. So I'm excited to Natasha's put this together and done a wonderful job, and happy to participate.
Thank you so much, Doug. So, what is CCM or chronic care management? Chronic care management was introduced by the Centers for Medicare and Medicaid back in 2015 as a way to help improve the quality of care for patients with chronic conditions. And it provides a framework for healthcare providers to offer a more comprehensive, patient centered approach to managing chronic health conditions. Who's eligible for chronic care management? These services are available for patients enrolled in Medicare as well as Medicare Advantage and some other insurance plans. And it is for patients who have two or more chronic health conditions, which are expected to last at least 12 months or until the patient passes away. Those conditions may place the patient at significant risk of death or may cause an acute exacerbation or decompensation in their condition. Additionally, the condition may cause the patient to have a functional decline, leading to more complications. So whether the patient ends up having a stroke and then having challenges with managing the consequences of the effects of the stroke. So, what conditions are covered under chronic care management? Some of the conditions that are covered are Alzheimer's disease, related dementia, as well as arthritis, atrial fibrillation, cancer, cardiovascular disease, and a lot of other chronic conditions are covered: diabetes, hypertension, and CMS does have a database where you can look up those chronic health conditions. So, what are some of the benefits of effective chronic care management for patients and providers? Doug, what would you say are some of the benefits for the patients or the providers, in your opinion?
Well, let's face reality. We most of us see a doctor, and then after we see a doctor, we get a care plan or a treatment plan, but it's a soap note, right? In the P portion of the soap note, and usually it contains follow up in 3 weeks or 3 months, and all these instructions with how to modify their diet, different referrals you've made to get their labs, so on and so forth. But we drop the ball. There's no follow through.
Mhm,
Most patients see a doctor very statically throughout their life, and they just don't have um, the knowledge nor awareness of how important it is to follow up and talk to the provider about starting that new medication. What was the response to that? Did they have any side effects, or did they get that treatment that doctor suggested with a physical therapist, or follow up with maybe a specialist, or with some other therapies? And how does this work out with their whole home life situation? It's we have to, case management really looks at what type of environment are they living in? Are they cooking their own meals? Or are they dependent on somebody else cooking their meals that may not be aware that they need to be on a low sodium diet or a sugar free diet? So taking all that stuff into account is complicated, and it needs a person to unravel that for that patient. Until we get to the point where we get more detail orientated with this follow through, we won't make improvements. And that's what deeply addresses, is detail orientated with that follow through and make
mhm.
improved outcomes.
Right. Yeah. So CCM helps patients to manage their chronic conditions more effectively. It provides a minimum of 20 minutes every month of care coordination, which leads to improved health outcomes for those patients. It's been found that patients who receive that minimum of 20 minutes per month have better control over their health conditions, they have fewer hospitalizations, and reduced mortality rates. It involves a team based approach to care, with the providers working together with the care managers to help coordinate and manage a patient's care. This ensures that the patient's healthcare needs are met across different providers and care settings, because care managers also help with transitional care management for when patients are discharged from facilities and they go home. Care managers follow up with those patients, review their medications. It also provides regular access to a care manager to provide education on disease management, support, and guidance as well. This helps the patient to better understand their condition and leads to greater engagement in their own care. Patients also have greater access to their care, including after hours support, because with chronic care management, we're required to provide 24/7 access to care managers who support and help them to navigate the healthcare system. This is especially beneficial for patients who are, living in rural areas with limited access to healthcare, because and care managers also help those patients to connect with community resources like transportation, Meals on Wheels, and other services that are available in the community. For the providers, CCM allows the providers to monitor the patient's health condition more closely. And patients who receive CCM services are more likely to feel supported because they know that they can reach out to their care managers and have that regular communication. Every month, the care manager reaches out to that patient, discusses their condition, and so that ensures that the patient is involved in their care. And this can also help to streamline the practice operations and improve the delivery of care. And if, let's say, a patient has multiple providers that they're seeing, the care managers help to coordinate care between all of those providers as well. And that improves the care coordination, and providers that participate in the CCM program, they have improved their MIP scores and quality metrics. So they're able to get that incentive payment uh, as opposed to having to pay a penalty. And finally, CCM helps providers, increase their revenue by uh, providers are able to bill for those services and get reimbursed for those services. Doug, we have a question. Someone's asking, what is the best way you have found to offer that 24/7 coverage for care managers?
Well, what we've done is we've networked with, because I worked with the health plans to set up call centers in the Philippines and in Costa Rica. So we work with call centers to be that initial customer service, and then they transfer it to our nurses that can take over the call and then have access to their not only their medical records, but since our patients are on RPM, they'll have access to their trending data that we've received with their like blood pressure monitoring or whatever they're being monitored for. And so this is very helpful that we can access that information readily. It's not a siloed 24/7 nurse call line like most people have on their insurance card and things like that. So that's where we try to make ourselves different, and where we're trying to reach out to. Now I'm on the other end of things, trying to reach out to the health plans and ACOs and getting those contracts. But by and large, most health plans and ACOs um, participating in these value-based care programs don't really have a very good established vendor network to help them with these services. And this is another area where Natasha's done a great job to bring this awareness to nurses to understand this, and so that they can be linking them up and getting these programs started in their area.
Okay, thank you, Doug. So I wanted to just kind of break down the physician fee schedule, which is what we look at when we're looking at reimbursement for these services. So the first 20 minutes of care coordination every month, based on my location, I'm in Long Island, New York, is reimbursed at $73.29, and that is in 2023. That is up from $48.65 in 2021. So as you can see, there is an increase in the reimbursement for those services because CMS wants providers to provide those services. Therefore, they increase their reimbursement. Additionally, if that patient receives two additional 20-minute intervals of CCM every month, in New York, based on my location, again, that's $55.28 for each additional 20 minutes. So if a patient receives 60 minutes of care coordination per month, the potential reimbursement for that provider is $183.85. And of course, this amount does not factor in the 20% copay that the patients are responsible for. And Doug, I would ask you to just talk a bit about, the act or that's being looked at in Congress that they're trying to eliminate the copays for these care management services.
Yeah, so over COVID, those co-payments got waived under Medicare Part B, and that's where most patients that have Medicare, whether it's a fee-for-service Medicare or even with the Medicare Advantage plan, they owe 20% for all Medicare Part B services. And that was waived during the public health emergency time. And so now there's been congressional efforts to continue that waiver because they see this lack of engagement, basically. And a lot of people are delaying treatment and care because of this hesitancy that they're going to get balanced billed. And we realize that, and there's lots of talk in the Senate right now saying we need to remove that fear from people and let them know. I mean, we're almost meeting them at 100% anyway. We're already meeting them at 80%, and we don't want to deter and make it more complex. A lot of what happens with like here in California is we get patients that have supplemental coverage. It could be something through a pension through their work, or if they're at a poverty level, it could be the Medicaid system. And so that supplemental would cover that. But that takes some time and a huge amount of administrative efforts to connect those two programs together, and it's not automatic. And so if we can just automate it from one end by eliminating that copay under Medicare, this would resolve a lot of that problem and save us a lot of those administrative costs. And that's what they're arguing right now in Congress to get the budget to do these things.
Okay, thank you, Doug. So, the services are paid for by CMS, like I said, and CMS pays for clinical staff to provide the service, or they would pay for the physician to provide that service directly. So if the physician provides that service directly, as opposed to them having their clinical staff provide the service, it's covered. And the first 30 minutes of that care management every month, if it's provided directly by a physician or a qualified provider, such as a nurse practitioner or physician assistant, again, in my area, CMS pays $98.87 for that first 30 minutes. And then each additional 30 minutes, there's an additional $70 that's paid directly to the provider for providing those services. So comparing those codes to an E&M visit, which is an evaluation and management visit, a level 2 E&M visit would be 10 to 19 minutes, and CMS pays 67.53 for that level 2 visit. So as you can see, there's a difference, of course, in the amount paid between the care management and just an E&M visit. So again, for 30 minutes, the provider gets paid 98.87 if they're providing care management directly to the patient, compared to a level 2 E&M, which is paid at 67.53. Again, that's based on my location and the physician fee schedule in my area. For a level 3 E&M visit, they are paid 106.91 in my area. So when we're looking at the rate of return for a physician potentially providing CCM services every month to their patients, again, this is, every month you have that revenue coming in. And let's say the patient receives 20 minutes every month, and you have 200 patients per month. That is a potential monthly reimbursement of $14,000, and annually potentially 175,000. Of course, you would have to subtract the cost for the copay and then the staff that you may need to hire to provide these services. So that is a bit about the reimbursement for those services. And now we're going to talk a bit about what is remote physiological monitoring and its impact as well. And this is something that also complements chronic care management, and physicians can monitor the patient's vital signs remotely. Doug, I'll ask you to talk a bit about remote physiological monitoring, because that is something that uh, are very knowledgeable
Yeah,
on. You're an
that's my
expert in
thing.
that.
Yeah.
That's your thing. And yeah, so I'd ask you to talk a bit about the remote physiological monitoring.
So the remote physiological monitoring, we can talk about the insurance Medicare reimbursed, and then there's also a way to do it privately too, directly as a cash payer. But let's focus on the Medicare reimbursed one because most people would like to take advantage of that. Again, it's covered under Medicare Part B, and it has four different codes: 99453, which is the initial setup and explanation of the program; 99454, which is the 16 days of monitoring; and then the 99457, which is the 20 minutes of discussion about the RPM; and then 99458 which is the additional 20 minutes, and that could be billed twice if you go over that time. So those are the focus codes on RPM. And to understand that, you need to understand the details of what is involved with each code and how to get that constructed and set up properly. With a new patient setup in an RPM program, it's very similar to a CCM program. There needs to be a care plan, there needs to be goals, and they need to follow up with a nurse about that care plan and those goals at least monthly. Minimal time is monthly. And so the way they, I think the way they designed it, I don't know specifically, but they figure those 20 minutes, it may not be one 20-minute call, but it could be a 5-minute call every week. This time could also be consumed with the time you are evaluating that patient's past medical history, their medications, the referrals to the specialist, whether you're calling them and making sure that they saw that specialist, managing that patient. So that can construe in some of that time, but there needs to be a focused effort in that time where you're discussing the results of the data you're receiving through that sensor. And you have a variety of sensors you can get data from. The most common one is the blood pressure monitor, and that needs to be an FDA approved blood pressure monitor that captures that information directly, meaning that it needs to either go through, it can go through Bluetooth and then to the cloud, or go directly to the cloud with a cellular connection, but it needs to be captured by the device and not data entered by someone like entering that data on their phone or their computer. So that's one of the criteria for that. But you don't have to negate any other information. Let's say that person has a weight scale at home and they've been very consistent about doing their weight. You could still write that information as an antidote, or additional information as you discuss with that person, whether or something else. Maybe they're doing their own blood sugars because they've been a diabetic, and you can capture that additional information, and it won't take away from the monitor. But there has to be one monitoring device that is capturing that information digitally at least 16 times during that billing period. And usually we do all our billing on a monthly cycle, but you could also drag it out to a 30-day cycle that doesn't coincide with the beginning of each month. And so that's the more specifically on the 99454 and the 99457. When you get into the additional minutes with the 99458, you need to show what you've done with those additional minutes. I think you need to be consistent with the workflow and with your notes as you're discussing things with that patient, and have some references to the time that you're spending exactly what you're doing with that time. And that's where we try to make ourselves different than a lot of these companies that have launched this through sales and tech people. We're nurses, and we try to bring it to the nurses. And this is what I would write in my nursing note if I was you when I'm talking with a patient that has these conditions, so on and so forth. So I see we've got the others that joined us, so I'm very happy to welcome them that they made it, and I'll give them some time to speak too.
Yes, yes. Thank you so much, Doug. So a little bit of technical difficulty, but thank you, Laura and Elena, for joining us. I'm happy, we worked through the technical difficulties we were having. So, Laura, I'm going to ask you to just introduce yourself and tell us a bit about your background. and we are talking about remote physiological monitoring. Just give us a little bit of information on what you do as a nurse who provides remote physiological monitoring and what you've seen on the impact it has had for patients.
Thank you, Natasha, for the introduction. I'm Laura. I am Doug's partner, and we've been in the space. I've been in the space since 2014, when it was first starting to be established and approved through CMS. I've worked with many app companies to help develop the background, the SaaS programs to help nurses facilitate charting. And I've rolled out quite a few different programs to different practices of RPM, CCM. One, our TM, which we'll go in later in a different discussion. And I definitely have seen the impact that it has had, particularly with people with hypertension. It really helps them to see their numbers and to start correlating it with activity, diet, medication regime, whatever. They correlate it and they can make differences in their lifestyle. And it really helps manage their blood pressure. It's tangible evidence, they can't deny it, and they can see the trends and track it. So it's been very, very helpful in keeping a lot of patients from, crisis having to seek acute services. And they feel more engaged. They really do, because they can make a difference and they don't give up or get frustrated. So I am a strong proponent for remote physiological monitoring.
Mm.
And I'll give it to Elena.
Okay, yes, Elena. Introduce
Hi,
yourself.
everybody. Welcome, everybody, and thank you for welcoming me. So I'm just going to introduce myself. I've been a nurse for over 25 years, working in long-term home care and hospice, providing those services. And recently, a few years ago, I embarked on the journey with the doctor who co-founded the remote patient monitoring platform. This is where I started learning about remote patient monitoring more in detail. And I realized that there's not much information out there for other nurses to learn about. So meanwhile, I was learning and implementing RPM programs for doctors as a pilot program. I started developing online course for other clinicians, whether it's non-clinical or clinical people who would like to, start with the RPM program in the doctor's practices. Compile the online course for clinicians, for nurses, to really up-level the skills by quickly familiarizing with all aspects of remote patient monitoring and transitioning to work from home. So this is something that I bring with my experience being in the staffing industry. I partner up with RPM companies, healthcare providers, any healthcare companies who are looking to hire nurses on full-time basis that will be able to work from home and do the remote patient monitoring, because we saw the impact on patients firsthand. Patients feel more comfortable getting those phone calls and guiding them through different metrics, if they are having chronic conditions. So nurses are there to really monitor and validate data, reach out to doctors and coordinate better care, avoiding those hospitalizations and rehospitalizations. So I've seen a very good, impact on patients. And patients are the patients seem to be very pleased with services. So I'm promoting RPM anywhere I go, and I also help nurses educate and up-level their skills in work from home, technically.
Thank you so much. And I think that with all of us, our goal is to not only provide these services to providers and patients, but to educate other nurses about, how they can use their skills that they've learned over the years to provide these services directly to patients, because, we do have that background and clinical experience as well as organizational skills as well to help implement these services within medical practices. So I'm just going to go over again just a little bit of what Doug talked about. So remote patient monitoring or remote physiological monitoring is a way for healthcare providers to track those patients' vital signs outside of your traditional clinical setting. And so not everyone gets a blood pressure or a monitoring device just because they have hypertension. Um, Laura, I'd like you to kind of go into that, that everyone doesn't just get a blood pressure monitor. Who would be, who would benefit more from having a blood pressure monitor? And when would it be the right time for a physician to say, hey, I think this patient should be enrolled in a remote patient monitoring program for their blood pressure?
If they have a diagnosis related to hypertension or cardiac disease, CHF, all those, in those families, they would definitely benefit from
Right.
having their blood pressure monitored. Uh, they have to have the ICD-10 code that correlates with it.
Yeah.
That's number one. You can also benefit. Let's say if they've had this for the diagnosis for a long time, and they've changed their blood pressure medicines for some reason. Let's say they become more hypertensive or hypotensive. It's really good to monitor them because any blood pressure changes, with the medications, you you really are surprised at how many patients decide, I feel bad. My blood pressure is getting lower. I can't function, or I'm getting headaches. I just don't feel right. So they stop taking it. There's a variety of side effects from any blood pressure medication that the patient might stop taking it. Well, that's not a good thing either because they were on for a reason.
Hmm.
So this way it gives you a chance to look at it and say, wow, yeah, you are getting a little low. What's going on? Don't stop taking it. Let's get you a different medication, or let's see if it needs to be decreased. Let's discuss this before you just arbitrarily stop your treatment. Um, it's just a good indicator.
Yeah. So, Elena, how are providers paid for RPM services? What, is covered under the RPM, how many CPT codes are covered under your RPM program?
So what we've noticed, every time the patients come in, and when we bill, mainly Medicare would pay for several CPT codes for RPM specifically. We have RPM for education as setup. This is like a one-time fee that the Medicare would pay, and then we're going to have CPT codes for using the technology, and then for the monitoring services. So there are several nuances where there's a time frame is also comes into effect where you have to monitor for 20 minutes per month, and you have to have 16 readings per month. So those CPT codes are available, and Medicare guidelines clearly describe the eligibility criteria before billing. So the platforms make it available. They have these billing reports that are created or generated based on the activity, and then once billed, Medicare usually pays, with within, I don't know, 14 days or 30 days. So it shouldn't, it's not a problem to pay as long as you have, have the patient met the eligibility criteria and you have provided the documentation that support your monitoring services.
Mhm. And so, as you said, Elena, RPM has the component of the care management as well as the device monitoring. But if a patient's receiving CCM, can they also receive RPM, Laura?
Yes, they can. RPM is going to specifically assess the data from whatever monitoring they're using. If it's a glucose, if it's the blood pressure medicine, blood pressure cuff or O2 sat, that from that machine. CCM is going to look at the whole picture. Right? They can go into, they have to qualify first with at least two minimum chronic conditions. And you can use that data to back up other things because we all know usually the chronic condition has multiple factors, that go into it, like hypertension. You can have stress, you can have pain. There's other things that could be going on. So CCM allows you to look at that whole big picture and go into the other disease processes and managing them to follow-up visits to endocrinologists, orthopedics, whatever else is going on that's associated with those other chronic conditions. So it's more of a big picture where RPM is just zeroing into one issue, one diagnosis, and monitoring those factors. So I hope that kind of clarifies between the two, but you
Right.
can definitely bill for both within the same month.
Right. So you can bill for both of them, but I think what is important to know is that they shouldn't overlap. If you're providing 20 minutes
Correct.
for RPM, you can't use that same 20 minutes for RPM and bill it for CCM as well. So you can't do that. It has to be, separate services, two
You need
separate 20-minute intervals, right?
yes,
Mhm.
clear documentation and different minutes. You can't use them both. Now, you can mention some of them in CCM, but you have to clearly have 20 or more minutes for CCM with all the chronic conditions that you're managing within that patient.
Thank you. And so now we're going to talk a bit about value-based care because we are transitioning more to what's value-based care, where the focus is on, patient outcomes and improving the delivery of care as opposed to just, physicians seeing patients, repeatedly and not really having improved health outcomes. So I'm going to ask Doug if he's still there. Doug, are you there?
Yeah, I'm still here. I was just driving so I can.
Are you driving somewhere? Okay, well, I
I,
want you to be safe. So, I will continue and ask Elena.
I could talk, Natasha. I
You
could.
can talk?
I,
Okay. All
I
right.
can't
So,
keep.
so just talk a bit about the connection between CCM, RPM, and value-based care. And then, of course, we do have some other programs that we'll go over in the future, but just the connection between those three and two and value-based care.
I spent many years working for managed care plans, specifically for health plan and Cigna health plan and health plan, doing case management. And you have to understand, we were the ones that were connecting all the dots for those patients that were on our case management programs. And when you have a nurse that intensely involved with a patient, because we would usually have no more than 100 patients, we had a cadence where we would talk to them every week or every month. But part of our conversations would be ensuring that they were getting their preventive screening done, whether it's a flu shot, whether it's a diagnostic study that they need, like a mammogram or a colonoscopy. But those are really critical areas that the health plans must capture if they're going to get that extra reimbursement money for their improve their star ratings. And so it's critical that not only with the managed care plans and that arrangement that they have with the government providing managed care, but also now directly to that primary care doctor or that specialty doctor under the MIPS and PQRS programs, where they have to show that they are improving the quality outcomes of their patients by capturing these preventive screenings and preventive visits during their, as they're managing that patient. And that has been clearly defined in the CMS regulations to the point that if they don't improve their engagement and improving the quality matrix with their patients overall, they will get a reduction in their reimbursement for those same CPT codes that they used to get, maybe 100%. It'll drop down and they will get a reduction of those code reimbursements for not providing that additional information and showing that they're doing that.
Okay. Thank you so much, Doug. And Elena, I'll ask you to kind of pick up on that, on what you see as the connection between these new programs and value-based care. And what has been your experience with implementing these services within a medical practice?
Well, it's definitely benefits the patients. From my experience, I know that patients don't want to go to the hospital, and we all know that we are trying to improve, health outcomes.
Mhm.
And being in a hospital with one thing and wind up with another thing, it's not really. Something that could be avoidable or preventable. It could be treated from home, and I think the CCM does a wonderful job in coordinating care, doing those regular assessments and creating care plans for patients. Also helps with medication management and coordination, which is the key. And the RPM is on as a complement to CCM, has the continuous tracking or monitoring of vital signs, which also kind of gives a better picture for the provider to know about patients' conditions. And I think it's really the impact is great. Patients benefit from this, and no wonder that Medicare really promoting this and reimburses physicians for the services.
Mhm.
So I think an overall it's a very good program. Both CCM and RPM are great programs, and also the RTM, when it's RTM is going to be fully implemented with many providers, this is going to give a better picture overall for patients, conditions, chronic conditions.
Mhm. Thank you. And Laura, do you have anything that you'd like to add to that as well?
Yes, I do. If you've noticed, like within the last 10 years, okay, for historical that we have always had a reactive medical system,
Mhm.
here in the US. And that's the nature of the beast. In the last 10 years, CMS, you can look to see they've tried to change that to being a proactive versus a reactive system.
Mhm.
And it works when it's followed, but it's still very, very new concept. I mean, 10 years in healthcare in the US is like yesterday in
Right.
any other times. So it's been very, very slow to change. However, it's getting there,
Mhm.
and you're going to see consumers are already they're grasping onto wellness because they realize that the healthcare system is fragmented. It's not helping keep them healthy. It's there when they're not healthy, but we want to stay healthy. We want to be healthy. We
Mhm.
don't want to have to use acute services unless it's absolutely necessary. So the reimbursement is kind of well, it's definitely shifting to more proactive medicine, value based,
Mhm.
than the reactive medicine that you see, that's always historically been there. And
Mhm.
I think that that's wonderful. And I'm
Yeah.
a strong proponent of it, and I would love to see it.
Yeah, yeah, I love to see it as well. And, I think it's important that patients know that the services are available. But if the providers don't know, or they're not implementing the services, so they're not discussing it with their patients, then how are they going to know? So I feel that it's important to also, for me, I know to be out in my community and talking about these programs and letting patients know, hey, this is a service that is a bit available to you, that you can have someone you can reach out to if you have a question about your medication or your condition, that you do have that support that you can receive. So getting the information out there is really important. And I feel that that is part of the role of nurses in CCM and RPM, and of course, delivering value based care services. So, we're going to talk a bit about the role of nurses in CCM and RPM. And nurses, we are positioned to, take, pivotal roles in implementing these programs. And it's not just CCM and RPM, like Elena mentioned, RTM as well, which is remote therapeutic monitoring. And our experience in implementing programs, policies, processes, that gives us the background to help manage these programs. What else would you say, Elena, is the value that nurses bring to delivering these programs?
Well, from my experience, I understand that there's a lot of companies, RPM companies, rolling out their platforms, and what I've came across with is that the technology people, they recognize the immense knowledge that nurses have, and they looking to merge the technology with the clinical aspect by having these nurses learn and learn how to navigate through platforms and really contribute the expertise that nurses have in different in different areas. So it is of course valuable for nurses to learn and bring their expertise into the world by engaging patients. The biggest part for medical, for technical, for technological companies is to engage patients, and who would do that best? Nurses who would communicate, present, give value to patients, to talk about, different management of their conditions, and to really engage and educate patients. And this is what nurses are trained to do. This is what nurses have experience in. And I think it's only gonna grow in the industry for nurses to learn, up level their skills, and promote RPM, because patients do benefit from those services.
Yes, yes, we do. And Laura, would you like to add as well what you see as
I
the value that we bring?
I totally agree with Elena. It brings value back to nursing as well, though, because we get to operate at the top of our license, and it is so rewarding to see when you make a difference. And that's what most nurses, entered the field to do, was to make a difference and
Right.
to help people. And this is a way that you can really do it.
Mhm.
So the field is wide open. Elena, you mentioned that there are tech companies out there that are developing these monitoring devices and programs that need our expertise so
Mhm.
they can keep the patients engaged and also be within compliance of CMS guidelines.
Yeah.
So we are definitely in the driver's seat when it comes to RPM and CCM.
Yes, we are. And the thing about it is that we don't need to get any additional certification to provide these services. We use the nursing process. We assess, what's going on with the patient. We make a plan, and help them develop that, patient-centered care plan. And, we determine interventions and then assess those, or evaluate those interventions. So we use the nursing process. And so, we don't need that additional certification to provide these services. So this is why we encourage nurses who are looking for, they want, whether it's something they want to do at the side or they want to go into it, they want to work in the field, to educate themselves on, how they can get into CCM, RPM, and these other value-based programs and work, as Laura said, at the top of their license, with, whether it's with software companies or working in a provider's practice, to help implement these services. This is the value that we bring. And I think it's important that nurses do know, that they're able to do that. So, Laura or Elena, is there anything else you guys wanted to touch on or discuss during this chat today?
So aside what we just discussed, I think it's good to mention that we are developing the community for nurse leaders to really learn more about RPM and CCM and inspire others to learn and implement those programs in anywhere they go. We see a surge of nurses looking for remote jobs, and this is one of the venues where they could really upskill themselves, because nurses are adaptable. If you give them the education, they'll be able to really easily navigate through technologies and really contribute, contribute their skills and expertise. So the the courses are to follow. Okay, so we are developing many courses that are going to be placed in the community space for nurses, clinicians who are looking to implement RPM programs, CCM programs into their practice. And I think if we follow Natasha's lead, she'll be posting the invites for those who would like to join. This is a kind of free membership where you're going to get updates and learn more about RPM and CCM.
Yes, and so that is in the Mighty Networks, right, Elena?
Yes, it's the society name is Empowered Nurse Leaders.
Yes. And so that's what we are, empowered nurse leaders. And so we invite other nurses to join our community on the Mighty Networks, as well as, follow us on LinkedIn and the other platforms so you can learn as we continue to share more information about these programs, so you can get into this field and learn more. Laura, is there anything you'd like to add or talk about?
Just to encourage nurses to join the Mighty Networks and learn more. A lot of nurses, particularly in my age group, are a little intimidated by technology, and as we experienced even at the beginning of this video cast, we had some technical difficulties linking in, but we managed to navigate through it.
Right.
Those things are going to happen, and you can't avoid it. But you just need to make yourself comfortable with technology. It's not as scary as you may think,
Mhm.
and we can definitely help you simplify it. So,
Right.
again, this is the future. I just encourage everybody to jump on the bandwagon.
Yeah.
Yeah.
And Doug, I'm not sure if you're able to share your closing thoughts as we get ready to close out.
Yeah. So let me just take this a little more granular. Most of us have a smartphone in our pocket or on our desk, and or maybe even a smart watch, an Apple Watch or something like that. You need to, learn how to embrace this technology. I've been a gadget geek for many, many years and have loved using gadgets, and that's how I got started monitoring myself for with my cycling and to improve myself for training better and sleeping better and everything else. But we can also there's free apps now available, and platforms that you can look up online and learn how to use. You could be monitoring yourself today with an RPM program that uses your camera on your phone to take your vital signs. Now, it's not FDA approved, but it gets you into the understanding of how simple these apps can be. And it's just a matter of the more you know how to use this technology, the better you will be able to translate that into your practice as you're helping either deploy it and teach it to others, or you're helping to individually talk to your patients about utilizing technology in their daily life to help monitor their health condition.
Thank you. Thank you, Doug. So again, we hope that you guys join our communities and reach out to us if you do have any additional questions or want to learn more about how you can get into RPM, CCM, and of course the other programs. Like I said, we will be discussing in upcoming meetings. So I also have the Nurses in Chronic Care Management. It's a Facebook group that you can certainly join as well, where I share information, and the Mighty Networks, where we will be collaborating to add more educational material for nurses or other healthcare providers that want to learn more about these programs. So I invite you guys to, reach out again and join our networks so we can get more nurses involved and, of course, help providers to implement these programs within their practices so we can improve, the healthcare system, which we know is right now very disjointed, fragmented, and patients have a lot of challenges navigating. So I think that is all for me today.
Yes,
And
there's
we
if
will.
there yes, and one more thing. If there's any RPM companies looking to improve their KPI metrics, we
Mhm.
also be developing program to train the internal staff of those who already implemented or those who initiate, those who are willing to implement their programs in their practices. So we do train internal staff through this mighty network. So just please reach out and join, and we'll take it forward from there.
Yeah. Okay. So we look forward to this, frequent meetings so that we can share our knowledge and collaborate with others. So thank you guys again for joining me today, and bye for now.
Thank you,
you.
Natasha, for
Thank you.
hosting.
Thank
Bye-bye.
you.
Thank you guys.
Bye.